Hi, welcome back to Rapid Regional Medical Center's The Dish on Diabetes. So this month's topic is, what is tight blood glucose control? A lot of times physicians and diabetes educators and pharmacists, they throw out those terms, tight glucose control. But what does that actually mean? Well, according to the ADA, which is the American Diabetic Association, and the AACE, which is the American Academy of Clinical Endocrinologists, they say that tight glucose control is getting your blood sugar as close to normal as possible without having any adverse events in the process. So let's talk about what those numbers mean. A normal fasting blood sugar should be below 100 with nothing to eat or drink for the prior 8 to 9 hours. Or 7 to 9 hours, around there. So below 100 is considered optimal. From 100 to 125 is considered to be pre-diabetic, and 126 or above is considered to be diabetic range. So any tight control would mean that you keep those numbers between 100 and 125 if possible. So make a goal, establish a goal with your physician on where your fasting blood sugar should be. There's also an hemoglobin A1C. The hemoglobin A1C is a marker. It's in the form of a percentage, and it's a marker to give a roundabout average of what your blood sugar has been over the last 2 to 3 months. Now, it doesn't mean that you can go out having Snickers twice a month. It just means that hemoglobin A1C is a marker to determine how well your diabetes is managed. Now let's talk about what the normal readings for that is. The normal hemoglobin A1C for a type 1 diabetic should be below 7%. 7.0%. The normal or optimal A1C for a type 2 diabetic is below 6.5%. So when you start reaching the 6%, anywhere from 5.5 to 6, you're headed towards that diabetic range. You're considered to be pre-diabetic. But once you hit that 6% mark, 6 to 6.5, you need to start some type of medication. Usually that's a physician's call, but usually they'll start you on a medication like metformin to keep your numbers down. Now, what does it mean to have tight glucose control? It just means that we're keeping your glucose in a range that prevents complications. And remember that hemoglobin A1C that we mentioned? Well, just a 1% decrease. For example, you have a 9.3 hemoglobin A1C, and we drop it to an 8.3. We just decreased your risk for complications by 33%. So let's say we go from a 9.3 hemoglobin A1C to a 6.3. We just decreased it 3%. Well, 3 times 33, we just decreased your risk for complications by almost 100%. So most times maintaining that tight glucose control is a way of preventing the deadly complications or life-altering complications that can come from diabetes. In regards to postprandial sugars, now let's talk about what those are. Postprandial sugars are a sugar reading, a glucose reading that you take 2 hours after eating. So let's say you eat your meal at 7 a.m. and then you wait 2 hours at 9 a.m. and you check your sugar again. Now, a postprandial sugar should be around below the 140 mark, because we would anticipate once you eat that your blood sugar goes up, because that's a normal body process, that you eat your meal, your blood sugar starts to go up, and then within 2 hours it starts to come back down. Well, when it starts to come back down, we want it to go all the way down back to your baseline, which should be between that 100, 120 mark. But when it starts going above 140 and then it stops and it never really goes back to baseline, that's when we know that your insulin response doesn't match your intake of food. So you may hear your doctor want you to take fasting blood sugars in the mornings, first thing, within 30 minutes of waking up, with nothing to eat 8 or 9 hours before. Postprandials, which is 2 hours after eating a meal. And they may want you to have your hemoglobin A1C drawn every 3 months. Usually, the ADA recommends that you have at least a hemoglobin A1C done at least every 6 months, which would be twice a year. If you're a newly diagnosed diabetic, you may have to have that done every 3 months for the first year. So you'd have 4 hemoglobin A1Cs done in your first year after diagnosis. And then thereafter, you can go to the every 6 months checks. Thank you for attending this month's edition on diabetes. I thank you, and good health to all.